Ready to take your health and wellness business to the next level? Today, I'm joined by Justin Chipperfield, an expert in building thriving practices and mastering the digital game. In this episode, we're breaking down the must know strategies for boosting your online presence, building strong referral partnerships, and using technology to streamline your business. Justin also shares how stepping back from day to day clinical work can actually fuel your growth. If you want practical tips to grow your practice and free up your time, you're in the right place. Today, we are sitting with Justin Chipperfield, founder of Chipperfield Mobile Physio and Wellness. Welcome, Justin.
Thanks, Scott.
Absolutely. Justin, you started in 2013 as a sole proprietor and have grown into a multidisciplinary mobile healthcare service. Can you share your journey and what inspired you to create this mobile healthcare model?
Absolutely. Thanks, Scott. I started out just wanting to do things a little bit differently. My background prior to starting my business was I'm a registered physiotherapist by training, and I had quite a few years of experience working in public health care in Canada, as well as at private clinics and long-term care homes. And I really felt there was a gap in our system for the delivery of home care for people who were leaving the hospital and going home. And hence, I started a mobile physio company, which was just a little bit of a different concept at the time back in 2013. And I just remember the first home visit that I ever did. And I had just such good feedback from the client, and I felt really happy because I got to spend more time with the client as well. Whereas like in the public healthcare system or in private practice, like it was often quite rushed. And this one-on-one 60-minute model was just really rewarding and refreshing for me.
Okay, I love it. Many health and wellness business owners struggle with scaling beyond just themselves. So, how did you transition from being the primary care provider and then to building the team of practitioners? And maybe like what challenges could you share that you faced?
Yeah, the thing that happened, I think, for me is that my training and background was more in the orthopedic world. And as I started to gain a bit of momentum as a sole proprietor out practicing in the community, I started to get some requests for various different conditions, like especially in the neurological realm. And I just so happened to work with another physiotherapist in the public healthcare system who was looking for a change and really was passionate about working with people with neurological conditions. So that person is still working with me, 10 plus years later. I think I just really lucked out in that first physio hire that I had where I was able to focus on building up the business on the orthopedic side of things, and Julie was able to focus on building up the neurological side of things.
Okay. And then your business has evolved from offering physiotherapy to including like seven different healthcare disciplines. How do you determine which services to add? What advice would you give to wellness practitioners looking to expand their service offerings?
Yeah, I've always really believed in that holistic, multidisciplinary care model, taking care of the whole person. As Julie and I started to get busier and get booked up, and we found that the demands for the clientele that we were seeing in the community in general tend to be more complex care needs. And so we were looking to add other people onto the team who could support the client's health and well-being. The first one that made the most sense for us was to add in a rehabilitation assistant. So this is a PT, physiotherapy, occupational therapy assistant. And from there, we started to add on other disciplines such as kinesiology and occupational therapy and registered massage therapy, clinical counseling, acupuncture. And it was really just what were the needs of the client. And while there are other disciplines that we would still love to add in time, those have been the key ones for us that have allowed us to have a system where we have a referral relationship in-house so that if we have a client that we're working with, we can cross refer them to another member of our team. Because as human beings, I've always maintained in this line of work that human beings are complex and they can have complex care needs, especially as we age and develop more health conditions. And so just having that multidisciplinary holistic approach has been really great for us.
Okay. Did you just a question about how you went about learning? Were you just having those conversations and you did some like surveying to kind of figure out like what do I add next?
Oh yeah, that's a great question. How it came up for me, honestly, was just if I had a client that I was working with and they would say to me, "Do you have a great RMT that you could recommend to me? Or do you know an occupational therapist that could help me with this or help my family member with this?" Of course, we would always want to make those strong referrals, and we still do to this day, if it's not someone on our team that can help. However, my inkling, like as a business owner, as an entrepreneur, was that I wanted to find that person. I wanted to provide that service. So it truly just came from listening to our clients and what they were asking for. And then, us going to back to the drawing board and going like, okay, how can we add these types of people or disciplines onto our team?
Okay. And then like thinking back to even when you added the first practitioner, right? The first person to extend what you were doing. Did you bring them on a couple days? Was it like, hey, we're bringing you on full time, or were you just like kind of gradually? Because now all of a sudden, say, look, I'm an extra person, and we're, it's like, but you're not full yet, or like, how did that come about?
Yeah, that's always tricky. But again, just thinking back to the first physio I hired, she literally started, I think it was 2 nights a week. Like she worked full
Okay,
time in the public healthcare system. And she started just seeing like, she gave me her availability, like, Tuesdays and Thursdays from 5 to 7 kind of thing.
okay,
So it really wasn't much. So it was nice. It wasn't a lot of pressure for me to feel like, oh my goodness, I'm responsible for helping this person, earn their living. But I remember after the first client that she saw, she called me and she was like, "Oh my goodness, that was so amazing." I'm like, "Oh, okay, great. Like, tell me, like, what was so amazing about it?" And she just said, "I got to spend time with the person. I got to spend like a whole hour with the person." And, from there, it didn't take long to get her full. And she realized like how, even though she had like a full time, great job in the public healthcare system, she realized that she could make a much bigger impact and was more fulfilled work wise in seeing clients. So she joined me full time, and then the pressure was on. However, um, the great thing about that person was that she was hungry and she was willing to drive in home care and in mobile care. Traffic is obviously one of those challenges for us, and especially living in a fairly busy city. But she would go pretty much anywhere. She would drive pretty much anywhere to see a client. So it didn't take long to get her firing on all cylinders.
okay. Love it. For health and wellness business owners looking to improve their online presence, what lessons have you learned about maybe creating an effective website and digital marketing strategy? One of the things that I just absolutely loved your website. I think it's very cool looking. It seems very user friendly. Maybe you could share a bit more about that.
Thank you. Thanks for that feedback. Yeah, we are probably on our, I'd say, fourth website in about 12 years. So it's just always been one of those things. It's a work in progress. A few years ago, though, we did take some time to meet with a few different website developers, and we created a whole new, like from the ground up website. So that was an investment. It was kind of scary because it was during COVID, and I was like, "Oh my goodness, can we really afford this?" But it was a lot of work. I had a lot of help from one of my admin team members as well, so I definitely owe her a lot of credit. Yeah, definitely having a professional to and really just take time. Like it took us a while before we kind of got it all finalized and finally launched it. And then more recently, we have been working with another, we did a rebrand last year, and the creative director that we worked with was just fantastic. And we were, not only changing our name as well as, our colors and everything. So we've been continually working on making some more subtle changes to our website in the last year, and working with the branding expert that helped us with our new brand, as well as investing in, like, from a digital marketing point of view. I think one of the biggest lessons we've learned is that a little over a year ago, we brought on someone to work directly with us on this aspect of things. We worked with some bigger companies in the past, or just tried things on our own for a lot of years, but we really got lucky and met someone in that space. And we've been working with her for like about a year and a half now, and we meet with her regularly, and she's been amazing.
Excellent, excellent. So having somebody like kind of that comes into the office or remotely.
Yeah, good question. I think we got kind of lucky because she was working for like a bigger agency, and she just broke off and kind of started her own business just as we met her. So,
Okay.
she's got her own business rolling now. So we're a customer, but
Yeah.
we feel like, I guess the thing is like we definitely feel like we are an important customer, I guess. Whereas
Yeah,
sometimes in the
that's good.
past, we were just felt a little bit more like a number. And so we meet with her on a regular basis, and it's all virtual, like, because of the mobile nature of our work and of our company. We all work virtually, so we don't have a brick and mortar kind of central meeting space.
That
So a
makes
lot of
sense.
our meetings do occur online.
Let's talk about your partnership. So building referral partnerships seems crucial to your business model. And can you share your approach to developing and nurturing these relationships with other healthcare providers?
Yeah, definitely. I think the biggest thing is just communication is key. So, that closing the loop on referrals, communicating, letting referral partners know that, we have received the referral and we have booked the referral. And more recently,
Thank you.
we've been having more, like one of the big things with me stepping away from client care that's been really beneficial, I think, is that I've been able to have time and energy in my schedule to dedicate towards nurturing these relationships. And it's really a matter of, like, it takes time, and I think consistency is important as well. So, just checking in with them, whether that's, monthly, quarterly, semi-annually, annually, just sort of just, like, having a conversation with them about, like, what's working, what's not working, what are their pain points, like, how can we I've been doing a lot more work around just trying to listen more, and just see, like, what their pain points are and how we can support. For a lot of times it's their clientele, essentially, right? For instance,
Yeah.
with it, say long-term care homes or assisted living care facilities, what their needs are, or with other private companies who are referring people to us, we really want to make sure that they're happy with the quality of care that their clients are getting. And so I think the final thing is just, making sure that you show some gratitude towards the referrals as well. So things like, especially around the holiday season, like, I always, fill up my car with wine and chocolates and flowers and poinsettias, and just go around and, essentially,
Face to face.
as a, yeah, face to face, like, as
That's
a way of
great.
saying, no, thank you.
That's wonderful. That was actually something I was going to ask you. Like, do you ever have like a virtual meet, or is it just a phone call? Are they emails and phone calls? But you even
Yeah,
like,
great question. I mean, I have to also give lots of credit to our administrative team on this, because they're often the ones that are in communication on a more regular basis with the referrals that are coming in and fanning out to our team. So more recently, I've been, if we do meet virtually, and sometimes in person as well, but I've been involving, our administrative team, especially our senior administrative team, in those meetings. So it's not just me,
Okay.
because I value the input and feedback that they bring to the table as well. And
Sure.
then, yeah, whenever possible, I would be more inclined to meet in person. So again, just as the mobile nature of things, lately I've just been going around and spending more time in the communities, dropping into some of the places where we do work, and
Okay.
also just
Checking in.
through like networking and meeting new people and making new connections and just listening. It's opened up a lot of doors.
That's huge. Yeah. And I think a lot of business owners often don't have that time, or they don't make that maybe kind of, I would say, like your top two, right? Of what should you be doing that's going to impact tomorrow? Like what should you do today that's going to impact tomorrow? And it sounds like, you've got these systems, and being able to check in and build those relationships is so important. So kudos on that. Let's talk about the technologies. Like, is there anything out there, any systems or technologies that maybe have been game changers, especially the way that you run your business, and how that you've got a remote team, and maybe anything that can track your metrics? Share that.
Yeah, absolutely. This is something that probably for about, well, all along, like especially as we started to grow a few years in, relying on some of those technologies. Like we've been using like Jane for our EMR for a long time. So that's kind of an all-in-one booking and billing system, one of our primary communication tools, as well as we've been using Slack for our inter-team communication tool for many years. We use Notion a lot as a team as well
There you go.
for,
Okay.
you know, yeah, we just find it to be a little bit more user friendly than some other platforms. We have, a call technology, yeah, call hero technology to track all of the incoming calls, and we we spend a lot of time tracking several different metrics just in like a Google Sheets. A lot of that is manual, and we are looking at potentially leveraging some of the new AI softwares that are out there now to make that more efficient. But for now, those are our primary tools that we use as a remote company to get things done and stay in touch. Zoom Professional as well has been, yeah.
Love it, love it. I've been practicing with different ways of using Slack too, so
Mhm.
we can talk about that a little later. Okay,
Yeah.
so as someone who has successfully stepped away, right? You've stepped away. You're able to go out, visit, focus on more things in the business or on the business. What what advice would you give wellness practitioners who feel that maybe they're the bottleneck, they're holding up in the business? Like, what advice could you share for them?
Well, one of the hardest things for me to do when I did it a few years ago was to gradually step further and further away from clinical practice, like being a physiotherapist. However, I realized at the time when things really started to grow more for us that it was just, it was a lot, like being working almost full time as a physiotherapist in the business, as well as, trying to run the business. Obviously I had help, but to really want to grow the business to where I felt the potential was, I knew that I was the bottleneck, and I needed to step away from clinical duties. And that was the hardest part, is just making that decision. I think, once you do it, like I've realized, kind of one of those aha moments that I had is, if I'm a full-time physio in this type of practice, say, I see 5 clients a day or so was my sweet spot, and let's call it 5 clients a week on average. But by me stepping away and focusing on, improving the processes, the systems, just like networking and taking time to like have a vision for where I wanted the practice to go. We've been able to literally like 10x that. So to the point now where, last week we had close to 300 visits. So it's just, you know, I think in large part, by stepping away, uh, I've been able to, really truly grow the practice, and it continues to really just grow. And so I'd say definitely it's worth it, if that's what your goal is. However, if you are quite like if working as a practitioner, whether that's a physio or another discipline, is what truly brings you joy and passion, and you aren't as keen to maybe grow it, then you either need to find people that are going to help you do that, and they're out there, or, you just need to have some difficult conversations with your team and some of your clients. That's the hardest part, is just telling your clients, like, I'm sorry, like, I'm not going to be your physio anymore. That's very challenging. But, once you do it, then the next hard part after that is continuing to be able to say no. I still get like, got a couple referrals last week of people that wanted to see me, and I had to say no, and that's still not easy for me.
I like too that you tapped into, finding more time to work on the business, but it's like, it sounds like when you did this, you found time to like tap into your own creativity, and where you weren't doing that before, but by removing these obstacles or just allowing this time, it's like, I can focus on this, I can focus on that. I wasn't doing any of this before. And then when you did that, like you said, you 10x it. So kudos. Okay.
Yeah, I mean, if you just look at hiring alone, like if you want to hire good people and you want to, hopefully hire well, that takes time.
Got to
It,
schedule
it
it,
takes
right?
it takes time and energy. And so if you're working a lot in the practice, where are you going to find the time and energy and space for that? It can be done, but over time it becomes more and more challenging.
Yeah. I mean, it's a job in itself, right? I mean, from posting an ad or something to going through and starting conversations and follow-ups and, making offers and training. There's a lot that goes into it. So I get it. All right. Justin, tell the audience how they can reach you.
Yeah, I can be reached at my email, justin@chipperfieldphysio.ca. Our website is chipperfieldphysio.ca.
All
Be
right.
happy to hear from anyone. I always love talking about business, anything rehab business related. If you're out there and you have any questions, I'd always happy to jump on a call.
Okay. Thank you so much, Justin. Thanks for tuning in to this episode of The Wellness Growth Show. If today's conversation sparks something for you, hit subscribe so you don't miss the stories, strategies, and insights from the front lines of wellness innovation. If you're a founder, operator, or health leader exploring growth into institutional markets and have a story worth telling, I'd love to hear from you. Reach out directly on LinkedIn or YouTube. And if you found this valuable, share it with a peer or post it online. You never know who needs to hear it. Until next time, stay well, keep moving, and keep building what matters.